Myanmar is one of many countries in Southeast Asia that has fallen victim to geopolitical crises and natural disasters. Cyclone Nargis in May 2008 left a big mark on Myanmar, exacerbating an already chronic health crisis. Action is therefore crucial from humanitarian organisations in order to give populations access to basic medical attention and decent health. Tulipe is an NGO at the crossroads between the private sector, represented by healthcare companies, and the world of humanitarian aid.
Tulipe is an important link in the medical supply chain, as it collects drugs and medical supplies from the companies to provide them to its partner NGOs. The NGOs then ship and use all these supplies in the field to treat patients.
It is against this backdrop that Tulipe has supported the Franco-Asian Medical Association, AMFA, for almost 20 years in Myanmar by supplying it with drugs and medical equipment supplies for patient treatment. Supplies provided by healthcare companies are packed into kits before being handed over to AMFA for distribution to the hospitals and dispensaries that the NGO supports.
We have three objectives at Tulipe. First of all, we coordinate product donations from healthcare companies located in France. This prevents unnecessary donations while meeting our second goal, which is to meet the actual needs of NGOs that send us requests. Tulipe's third task is to follow up on donations through field audits to ensure proper monitoring, traceability and use of medicines.
In southern Myanmar, in the Miek archipelago, kit-equipped association doctors go to the most remote populations to provide healthcare and comfort. In addition to these regular visits, AMFA trains local doctors and nurses so they can provide regular care at the dispensaries.
So this is to take before sleeping and this is to take during the day. Okay?
Okay.
Here in the islands, the population suffers from various disorders, respiratory illnesses in particular, as they are poor and don't have access to decent sanitation. That's why I'm here today, to treat these disorders and to save lives. The patients come here, register, and then see me for their checkup. I explain to them how to take the medicines that they get at the dispensary. All medicines that we receive are of very good quality and are highly effective.
Access to healthcare products is therefore of vital importance to beneficiaries. Without the generosity of healthcare companies and proactive NGOs like AMFA, these populations would be even more vulnerable. NGOs, Tulipe and healthcare companies are a winning team. At Gare Nord, near Charles de Gaulle Airport, the distribution circuit of drugs and medical supplies begins. The generosity of healthcare companies is reflected in two ways. They donate basic treatments to Tulipe, and their employees contribute, alongside volunteers, by preparing the kits for further distribution in distressed countries.
We have three types of kits: pediatric kits, adult kits and emergency kits. Once they are packed, the kits are ready for immediate shipment or are stored briefly at Gare Nord for later retrieval by NGOs for non-emergency purposes.
Realizing what these kits are made of is almost like being in the field. Seeing with your own eyes the syringes, compresses, antalgic drugs and antibiotics gives a really clear picture of what emergency aid is all about. The second thing that strikes me is that Tulipe is a true pharmaceutical establishment with the same rules for traceability, for example, or for quality, that are applied to a French patient at a neighbourhood pharmacy.
The only thing I think of is how happy the caregivers will be when they receive these kits, which have been prepared with such care, and in which they will find the emergency supplies that they need so much: antibiotics, antifungal drugs, antiparasitics, etc.
Back in Miek, in southern Myanmar, the mother and child hospital is in great need. Usually, patients' families must dip into their meagre savings to buy drugs and medical supplies at private pharmacies.
So Tulipe supplying a lot of the drugs. They are very useful for our tropical disease condition. In future, I hope there might be pharmacists and who is staying in our hospital, based on our hospital, and we can consult the pharmacists on to use and to use the effective and the proper dosage. So there might be the good team to treat the patient. Now we need the pharmacists in our hospital.
It's so important that healthcare companies continue to donate drugs, especially antibiotics, which are in greatest demand in countries like Myanmar. Most requests are from tropical regions, where antibiotics are the main medicines used. We also need lots of renewable medical supplies. Unfortunately, we don't get nearly enough donations. When I see the poor condition of hospitals here that lack everything, with not even a single syringe or needles and not even gauge compressors in the wards, it strikes me how much we need medical supplies.
Needs are critical in Myanmar. Without Tulipe, many of these patients would have difficulty receiving decent care and being healthy again.